Hi, Nathan. I'm Heather, the nurse practitioner student that's going to be seeing you today. How are you doing?
Good, how are you?
Good. Can you just tell me your name and date of birth?
Nathan, 6/29/79.
Thank you. How are you feeling today, respiratory-wise, cardiac-wise? Any swelling?
No.
Anywhere that you've noticed? Any shortness of breath? And I like to measure shortness of breath as in, you walk to the mailbox every day or certain activities that you do daily. How do you would notice a shortness of breath in doing something normally that you do every day? You realize, oh, I'm really short of breath and I do this every day, and for some reason things have changed. So nothing. Nope.
No.
Any cough?
No.
No. Okay. So I'm just gonna focus mostly on your heart and lungs today, and if you have any questions, just let me know. Okay. Okay. So I'm gonna look at the patient when they come in, just looking for everything to be midline trachea, symmetrical ribs. I'm looking at the AP ratio. His chest from front to back should be 1 times the total width. So, I mean, I could totally measure this, but that's pretty much 1 to 2. You're looking for barrel chested, which would come up with COPD, emphysema type of diagnoses. And then I'm gonna just palpate his lungs and feel that everything feels symmetrical and normal. Just kind of sit up straight for me here. Yep. And just feeling for any thrills or any like odd sensations. And another thing with palpation is I'm gonna have you go ahead and turn this camera, and I just want you to, I'm gonna look for fremitus. Any odd vibrations, fluid would indicate, if he's got fluid, some pneumonia or something. Just say 99 every time my hands touch the sides of your chest.
99. 99. 99. 99.
Thank you. It's just nice and even. I'm gonna have you go ahead and lay down, and I'm going to just kind of watch his depth, make sure it's nice and even respirations, not labored. And I would shine a light from the side with shirt off, of course, and just look to see if I see any odd pulsations, anything out of the ordinary. Sometimes with larger patients or just patients in general that you have a little bit of trouble hearing, you could have them turn a little bit on their left side to assess for murmurs and assess lung sounds. I'm not going to have you do that, folks. It'd be hard to see in the camera. So I'm going to palpate down to the sternal notch and then the angle of Lewis, where is your second rib space, and right below that, on the right side, I would, in that second, between second and third rib, the aortic, would listen for any aortic murmurs, and then pulmonary is on the opposite side, and then Erb's point is between 2 and 3, and then tricuspid, and the mitral down at the 4th and the apex of the heart. Go ahead and sit up for me. I'm going to listen to your lungs in the back, in front. So just listening for any wheezes, inspiratory or expiratory. I would note exactly how they are, what lung feels that they're in. Just take deep breaths for me. And then I'd listen down the back of the lungs. Any fluid at the bottom, rails, just thorough lung assessment, which you sound good. You don't have any wheezes or any strange noises. Be palpating for any lumps, any abnormal lymph nodes. I think that's pretty much it. Do you have any questions for me?
No.
Nope. Okay. Thank you. See you next time.